Hello and welcome to this video. It is the ninth video of the series studying and learning skills for undergraduate medical education. My name is Mohamed Hassan Taha. I am the director of the Medical Education Center at the University of Sharjah. And we are preparing these videos for undergraduate medical students, dental students, and health science students in order to support them with their learning skills as important professional competencies for advancing learning for better future graduates providing service to the community. This video will be about reflective learning in health professional education. And actually reflection is very important skills that need to be mastered by students at undergraduate level and postgraduate level for lifelong learning. In this session, we'll define reflection and reflective learning. We'll explore the different models that we can use in reflection, and we apply it in real experience. And we also explore the concept of metacognitive strategies to improve self-regulated learning. What is reflection? What do we mean by reflection? It is the process of thinking critically about our own experience. Why? To gain insight for future action. So we use our own experience. And when we use our own experience, that we mean it is personal experience. So in a summary, we have experience. We think about this experience, and then we put this in practice. We need to stop to do reflection, think about experience, understand why it happened, decide what to do differently next time, and reflection turn experience into learning. This is very important principles we have to take it into consideration by John Dewey. We don't learn by experience, we learn by reflection. We learn from reflecting on experience. What do you mean by that? If we are doing the same thing repeatedly, without stopping, without thinking about it, without understanding why this happened, without deciding to do it differently next time, we are not developing experience actually. We are repeating the same things over years. So for this reason, it's very important to differentiate between the experience, the real experience and non-real experience. The real experience comes from reflection. And if I'd like to advise you in two important concepts as a student, and you have to master it, I would say reflection and receiving feedback in a good way. And the next video in this series, the 10th video, video number 10, will be about feedback, as feedback is closely related to the learning process, and also reflection is very important learning in the learning process. So it is not sufficient simply to have an experience in order to learn. Without reflecting upon this experience, it may quickly be forgotten, or its learning potentially lost. It is a form of feeling and thoughts emerging from reflection that generalization or concept can be generated. So, and it's generalization that allow new situation to be tackled effectively. Again, experience comes from reflecting on experience, not from repeating things several times. So why experience alone is not enough? Maybe you can attend lecture, you can study for many hours, you can sit for exam, and still have a little learning happens only when you, and this learning happens, it is still little unless you analyze experience, unless you identify the mistake, unless you do adjustment for your approach again. So reflection helps you to avoid repeated mistake. Without reflection, you will repeat the same study methods, even when results are poor. With reflection, so that you can change the strategy and improve your performance. In order to have reflection and to do the reflection in a good way, you have to follow a framework. And we have different levels of reflection actually in medical education or in education generally. So, and I advise you to follow this ICSE framework for reflection. I for the information provided, S for self-awareness, C for critical thinking, and E for evidence of framework. For the information provided, you have to describe what happened or what observed through detail. And it should be honest and unbiased. And this should be sufficient to give the feeling that to an independent person it's actually done. And you have to think about that, and you have to critically provide adequate information for reflection. For self-awareness, you have to be honest about your performance, because reflection is about you. It's not about validation from others. It's about you. It's personal. And for C, it is critical thinking by breaking the bigger picture into the small part and doing analysis, identifying challenge, assumptions, problem solving, and so on. Provide personal analysis. This is very important, and identifying this. And then you have to provide evidence of learning by doing synthesis, judgment, and evaluation. What do you mean by synthesis? Synthesis refers to identifying new with old information and taking into account feeling, bridging this element into the whole picture. The judgment related to considering the possibility and weighting up, describing what needs to be learned, why, how, and evaluation is related to looking back to see what different made, and this is a very important thing to consider. Please consider ISCE framework. And we have to distinguish between superficial reflectors and deep reflectors. And I will focus on the right side of this. The superficial reflectors are those who their motives of others taken into account and consider. They have they are doing self-questioning. Self-questioning is evidence in them, and take on board different perspective. They have clear evidence of standing back from the events and considering issues with internal dialogue. They are focusing on the things that are likely to make their practice better. And they will question and clarify main issue, and they use organizing principles to then integrate the ideas. And they have active approach to learning, interacting critically with the context. So we want you to be a deep reflector. There are several levels of reflections. The first one level, the lowest level is not acceptable, is a descriptive reflection. The relatively higher level is acceptable, is analytical reflection. And the best one is the excellent one is evaluative reflection. And we use the framework ISCE to describe the three levels. I, again, for information provided, S for awareness, self-awareness, C for critical analysis, and E for evidence of learning. For the excellent one, as you can see here, for information provided, you have to use range of sources to clarify thoughts and feeling. For self-awareness, you have to show insights, seen performance in related to what might be expected of doctors, considering the thoughts and feeling of others as well as yourself. For the critical analysis, it is related to demonstrate well-developed analysis and critical thinking using the evidence base to justify or change behaviors. And for the evidence of learning, you have to show good evidence of learning with critical assessment, prioritizations, and planning of learning. Please take a screenshot for this slide and save it, and try to at least have acceptable level of reflection, which is analytical, and work on having excellent level of reflection, which is in addition to the acceptable column to be evaluative. Now we will go to the models of reflections. We have different models of reflection, many models. I will go through basic, common, the three models. Starting from the Driscoll one, it is a very simple models. Describe what, so what, and now what. We can do it for daily reflection. The Kolb model, which is related to experience. You have experience, then you reflect on this experience, then you conceptualize, then you actively experiment, and we are using it for deep learning. And there is a Gibbs models in which including these stakes, description, feeling, evaluation, analysis, conclusion, and action plan. It's one of the very good structured reflection models. Let us start with the first one, Driscoll model. What you for what I interpret a patient, maybe. So what I notice, maybe frustration while taking history and so on. And now what I will pause and ask open questions while taking history to improve my skills. This is example from clinical practice. So in Driscoll models, as you can see here, you have an experience in clinical practice. You describe any event for what, and then you purposefully reflect on selected aspect of this experience. For the so what, you have to analyze this event, and then you discover what learning arise in the process of the reflection. And for the now what, you process action following this event, and then you actioning the new learning from the experience into the clinical practice, and then you develop a new experience. So what, and now what. It's used for the daily practice. The Kolb model for deep learning, you have active experimentations, planning. Then you have experience. You have concrete experience. You start with having the start is here, having concrete experience. You are doing something, and then you review and reflect this experience, which is known as reflective observation. Then you have to reach conclusion from learning from this experience, which is named as abstract conceptualization, and then you plan and try what you learn. This is active experimentation. Let's see. So you have experience. Maybe you have experience while communicating bad news with patients, either good or not good. You ask yourself, how did I handle my emotion while communicating bad news? How did the patient, I listened to the patient and showing empathy. Then I learned the importance of showing empathy with patient. This is related to the abstract conceptualization, as you can see here. And finally, active experimentation. I try to apply active listening next time. By doing so, it will help me to develop deep learning. Now we have Gibbs model. Starting from here, description. What happened? Then describe my feeling. What were you thinking and feeling? Then evaluation. What was good and bad about the experience? Then analysis. Can you make sense of this experience? Then conclusion. What else could haven't done? And finally, action plan. If this arose again, what would you do differently? Let's take example. I took patient history for chest pain, but missed key questions about radiation, maybe to the shoulder or association of this chest pain with the other symptom. I felt nervous and disappointed with my performance. This feeling. I gathered basic data but lacked depth. My supervisor had to step in to complete the history. Then this evaluation. What was good and what was bad. For the analysis, I focus on remembering questions instead of listening actively. I only ask patient questions, but not actively listening to the patient. So maybe anxiety affects my focus. So I have to be trained to avoid anxiety in the future. The conclusion, what else could be done? I need to combine knowledge with better communication. Because in medicine, knowledge is not enough. We should have a better communication. And I have to put attention to details. This is very important. The action plan, and this is most important. What should I do next? Next time, I will review frameworks for taking history, breaking bad news, communication, and so on. Practice with peer, my colleague, and seek feedback after each session. And seeking feedback will enhance my learning. And inshallah, we'll talk about feedback in the next video. So from reflection to metacognitions, it's very important to go deeper. Reflection is about thinking about experience. Metacognition, which will be the rest of this session, is about thinking about thinking. And it's higher order of thinking that enable understanding, analysis, and control of own cognitive perspective or cognitive process. So, high level, enable understanding, analysis, and control of own cognitive process, especially when engaged in the learning process. And then 3 level of it. First of all, we start with identifying our needs, followed by developing and implementing a plan of learning, then monitoring and evaluating the progress. To start with the first one, identifying the needs, we cannot identify the needs well unless we identify the gaps. And identify the gaps by identifying the current knowledge and the target knowledge. And improvement is the key. So we have to, and we will do improvement by monitoring ourselves, by reporting, by evaluating, by reporting. So all this apply to the improvement. An example, how to use it. I plan, then I monitor, and then I evaluate. Plan, I will begin by reviewing the key concepts from lecture. Then watch a short video to visualize maybe this video in pharmacology related to drug pathway. For the monitoring, I can recall drug's name, but not mechanism. So this means that I am memorizing, not understanding. For evaluation, creating a concepts map help me connect concepts better than use maybe flashcard or the tools that I'm using. And I will use maybe concept map or mind map in the future of that. Today's session was about reflection. And I'd like to share with you finally the key message from here. Learning is a skill, and reflection during the learning process. In order to do reflection, we have to identify the levels of reflections and to follow a framework for reflection. Metacognition save our time for the planning and augment actually the reflection. And excellent students control and manage their learning. And excellent students will lead to excellent doctors and physicians in the future. And excellent doctors never stop learning. The last message from this video, we don't learn from experience, we learn from reflecting on experience. Thank you so much for watching this video, and I'm looking forward to seeing you in my next video, which will be about feedback in medical education. See you in the next video.